Hello, everyone. Welcome to Therapy Clips with Dr. O. I am from the organization Human Service Consultants. Today, I would like to focus our topic on relapse prevention skills. We want to prevent a relapse or a slip into drugs or alcohol. We do not want this to occur. So, I am going to target 10 relapse prevention skills in this presentation that can be utilized by anyone that is suffering the disease of addiction, in recovery, and trying to maintain their sobriety. So I'm going to move into telling you about number one. Number one is self-care. It is common for someone in early recovery to experience post-acute withdrawal symptoms when recovering from addiction. This includes insomnia, that means you can't sleep, and fatigue. These are the common triggers for relapse. So instead of using alcohol or drugs, I would like to suggest that you first get a physical examination, then begin an exercise program, maintain good nutrition with a balanced diet, and improve the quality of your sleep by developing a sleep schedule. Number two, HALT. HALT stands for hungry, angry, lonely, and tired. Most of the time people will engage in behaviors like drug abuse or alcohol abuse because they are having these type of feelings. They're hungry, they're angry, they're lonely, they're tired. So instead of picking up a drug or drinking alcohol, what I would like to see you do is to attend a meeting. You can find AA meetings and NA meetings online. If you're in my particular groups, I have already sent this information out to you to utilize. Keep it handy on your telephone. So whenever you feel the need for a meeting, all you have to do is look it up and there's a meeting that's going on. There's no excuse not to attend a 12-step meeting these days. Or you can always go face-to-face. You can go online or you can go face-to-face to a 12-step meeting. The next thing I like to speak with you about is number 3, mindfulness meditation. This concept of mindfulness meditation will teach you to become more self-aware. The better you are about knowing who you are and what your triggers are, it will prevent a relapse from occurring. Before a relapse actually happens, the person will have a slip. That slip means there's a one-time use of alcohol or drug use. So what does this mean to you? This means contact your therapist, your sponsor immediately so that you can get back on track. So now with this mindfulness meditation, you're going to learn different strategies to cope with the potential triggers that you may face. Individuals using mindfulness meditation remain clean and sober longer and report less cravings. So what I want you to do is to Understand what mindfulness meditation is. It's going into a quiet zone where you may include deep breathing, prayer, and meditation all at once. Or it's the concept of meditating while looking at a picture. Now, looking at this picture is going to include what we call guided imagery. In the background of this presentation, you see a pillow, you see flowers, and you see a container with colored water. You can focus your attention on this image and just deep breathe and relax. Also, with mindfulness meditation, it's the concept of acceptance. Accepting you for who you are. Letting go. That means letting go of all that old stuff that you can no longer use. Toss it in the trash. It's no longer useful. And just focus. If you want to repeat positive words to yourself, you can always do this. This is what we call positive affirmations. I am beautiful. I am worth it. I can accomplish things. But at the same time, you're doing your deep breathing. Number 4 is know your triggers. Triggers can be internal or external. So internal triggers are things like anxiety, irritability, stress, anger, and low self-esteem. External triggers are things like people, places, and things that remind you of past drug use, past drinking behavior. Number 5, join a support group. Once again, your support groups, if you have a substance use disorder, would be groups like Alcoholics Anonymous, Nar-Anon, Narcotics Anonymous. If there's a mental health disorder too, then the National Association on Mental Illness, NAMI, also have support groups that focus on anxiety, depression, and those type of disorders. Number 6, the grounding technique. The grounding technique focuses on 5, 4, 3, 2, 1. So these steps are 5. Acknowledge 5 things you see around you. And you can always include meditation. 4, acknowledge 4 things you can touch. 3, acknowledge the things you can hear. So that would be 3 things you can hear. Acknowledge 2 things you can smell around you. And 1, acknowledge 1 thing you can taste. This exercise is done with deep breathing. Focus your senses will help you to gain self-awareness and increase your mindfulness. This will help you to accomplish your daily tasks, throw away unwanted, unhealthy thoughts and feelings, help you to gain more self-control and feel less overwhelmed. It also reduces the risk of relapse. Number 7, deep breathing. Breathing in and out and being aware as the airflow enters your body and leaves your body. Please ensure that you're doing this very slowly. As you do this, Deep breathing, in and out. Relax. Think of something happy. And also, know that it can be used for pain reduction. Number 8, make an emergency contact list. So that when the urge come upon you to use alcohol or drugs, you have a family member you can contact, a friend, a sponsor, members of the support groups, your therapist. Number 9, play the tape through. What this means is you're going to think it out before it actually happens. So you're on the path of relapse or slip. What you need to do is to really sit back and think about the consequences of that particular action, of that particular behavior. What could possibly go wrong? Well, today drugs are mixed with all other types of substance than what you intend to buy. So you may buy cocaine and it may be mixed with fentanyl. Fentanyl kills very rapidly. Cocaine can throw you into a stroke or a heart attack. So play the scenario out. You're going to lose clean time. If you've been clean for 30 days and you decide to go out and use, you're going to lose that clean time. When you are feeling this way, our final thing to talk about is number 10. Get help. Don't sit there and play with it. You know what life has been all about to the point of needing recovery. Why go back there? Nothing is going to change. And a matter of fact, it's going to get worse. Listen to Dr. O as she speaks. Do not return to drug use for any reason. You may not live through it. With these words, I'd like to say thank you for spending time with me as I talk to you about relapse prevention skills you can utilize to avoid a slip or a full-blown relapse. Until we meet again, I'd like to thank you for your time and have a blessed rest of the day.